Welcome to Focus on Seniors, a television show sponsored by Helping Seniors of Brevard County, Florida. The show is designed to make you aware of senior issues, needs, and resources available to help us age in place and with dignity. This show will help you as you develop your own aging and care plan. Now, here is your host, Joe Steckler.
I'm Joe Steckler, and welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plan. Our topic today, a very appropriate one, is senior foot care. Joining me for today's show is Dr. Richard Koenig, podiatrist, Highland Podiatry Associates. He's on staff at Wichita Medical Center, Rockledge. Welcome, Dr. Koenig.
Thank you, Joe. It's a pleasure to be here.
Well, I tell you, I had you on my radio show, and I've been doing radio shows since 2000, December 7th, 2000. And you're the first podiatrist that I've had on in 12 years. And I decided I can't wait that long because the subject of podiatry and the importance of podiatry to senior foot care is just tremendous. As a podiatrist, well, how would you underscore what I'm saying about it?
Well, it is. And it's the single most important thing that we do, in fact, because seniors have time to develop foot problems and multiple foot problems, either related to their originally from the structure of their feet or complicated by other issues like diabetes, like neuropathy, like some of the neurological illnesses that affect their walk. And so it seems to get multiplied as one gets older.
Yeah. I had my last job in the Navy. I come in a Navy retirement home, and I took care of 550 people, and our average age was 77. That's younger than I am now.
Yes.
So it's driven home to me. But I realized then that I had many men, not so much women, but the men in wheelchairs that had open, festering sores on their feet. And once I took them out of the place, I talked to my doctor. I had 3 doctors on staff and 33 nurses at a hospital, a 60-bed hospital. I said, why? Why don't these people have a better appreciation for what they're doing to their bodies? Because in several instances, it led to amputations.
Yes, it does.
But the biggest cause of it was the word you used, diabetes.
Right. It's the single most complicated illness of older adults. Certainly not exclusive to older adults, but certainly centered around that. And so it has a lot of different phases to it, a lot of pathologies, if you will, that will ultimately lead to problems in the foot.
As a podiatrist and a doctor, you take care of people with young feet and old feet.
Yes.
What are some of the things that, as we grow older, what are some of the things that we should be more alert to, more aware of, or pay more attention to regarding our feet and lower extremities?
Okay, so number one thing to do is a reiteration of what you just said, awareness. Be aware of the fact that they do require care. You may or may not have feeling in your feet, and so you have to use your other senses. You need to feel them, you need to look at them, you need to have somebody else look at them, and maybe that's a good idea too, to build that right into the system where that these folks should probably have an annual examination of their feet by a podiatrist, along with their other physicians. And then from that, develop a good program of hygiene. And if they are diabetic, then maybe they need to have their feet looked at on a more frequent schedule, maybe every 3 months.
Yeah, when we did our radio, that 3-month interval sort of popped down at me.
Yeah.
But something else popped down at me when you and I did our radio show together. And the fact that when we talk about heart disease, we don't give the same attention to women's heart disease as we do to men's heart disease. It's sort of underscored. I think the same thing happens regarding care of our feet.
Mm-hmm.
I think that is probably the most neglected area of our body. We take and we buy these $2 flip-flops with no support on, and then most of the time that little tong thing comes through and you trip on and you haul.
Yes. True.
But we do these things to ourselves, doctor.
Well, there's an adage in medicine, we are our own worst enemies, you know, and that's primarily because we're neglectful. We don't take care of things on a schedule that they need to be taken care of. Case in point, you take an 18-year-old who plays football, is getting out of high school, and because he wears cleated shoes, he may have an ingrown toenail, which ultimately becomes infected. It's a little painful, a little red, a little tender, may or may not be a juicy-looking thing, you know, it may or may not exude pus, which seems to frighten people, but if it doesn't, they don't think very much of it, but it's still an infection.
Yeah.
They can go on for months before they seek treatment. Take the same situation, make it into a senior adult with diabetes, and they have hours in which to respond to that condition before the infection becomes such that it now requires perhaps hospitalization, perhaps a visit to the operating room to open it and clean it out, start the appropriate antibiotics, more than likely intravenously. So you can see the difference between the same situation, difference in age, difference in health, and the necessity to be more vigilant and quicker about it.
Well, I'm almost willing to do anything on a television show to make a point, but I'm not going to take my shoes and socks off so you can see my two big toenails, and I'm ashamed of them, and I know that I've neglected my two toenails. And you and I talked about that.
We did.
On a radio show. Tell our viewers what's wrong with my two toenails and what I could ultimately do to fix those.
Okay, good question. So what we're looking at is an infection of sorts. So the infections wind up being in two families. One caused by bacteria, and we pretty well know how that goes. The other type of infection is a fungal infection. Bacteria belong to the animal world, and fungus belong to the plant world. So this is a plant infection in the nail. Now, the nail itself is not much different than a hair shaft. And if one were to look at it under a microscope, you'd see little lines where the little layers of tissue have laminated together. The fungus gets in there. It likes the undersurface of the nail where the nail sits on the skin because, why? Well, a fungus infection is not different than a mushroom, so they like it dark.
We're on the south side of the tree.
Yeah, exactly, on the shady side of the tree where it's warm, moist, and dark.
Right.
And so when you put your foot in a shoe, it's dark, warm because you're warming it with your body, and moist because of the perspiration. And they thrive in that. So ultimately, that's what's happening to the nail. It has a fungus and nail infection. Now, to treat it, if it's a mild infection, it can be treated with a topical preparation, a liquid that's painted onto the nail after the nail has been burned down a bit to open up the pores of the nail and allow it to penetrate. And then you wait a few months because the fungus will be killed in about a week to two, but the damage that it did to the nail may take months for it to grow off and look better.
So it requires a lot of patience.
It does. It requires quite a bit of patience.
What I thought was so interesting, though, is that the nail itself is porous.
Yes.
And that medicine, when you put it on top of the nail, goes down through that nail to get to the fungus that's underneath the nail.
That's right.
But if you try all that and nothing works,
then the next step...
What's the next step?
Sure. So the next step is to numb the toe. And you try to numb it back where the tissues are soft, where the skin is soft. And once the toe is numb, you can remove the toenail plate completely and leave the skin exposed below. And once again, when that heals up in a week or two, then you start putting the medication on the skin that supports the nail. And now you're right into the source of the infection. Because it's a plant life, it has little roots, just the same as your grass would. And so those little roots have to be killed. So you need, again, patience allowing the medicine to soak down into the skin and kill the roots. So that's a more radical way to do it, but again, it gets rid of the problem.
It can be done, though.
It can be
fixed.
It can be done easily in the office with a minimum of discomfort.
Yeah. I had on my left toe, I had an ingrown toenail. It just really wouldn't go away. So what the doctor did, he got the longest, skinniest, most flexible needle I've ever seen in my life, and he took that needle and gave me a little shot on this side, and then he took that bigger, longer needle and sort of pushed that thing in, and it went all the way around my toe. Mm-hmm. You're following what I'm saying. You do the same thing?
No, because as you feel, you can use your thumb as a model right now. You can feel how dense the tissue is right around the nail, and dense tissue doesn't absorb the anesthetic very well without discomfort. But feel back a little, about 2 inches back, where the thumb joins your hand.
Yeah.
See, it's softer.
Yeah.
Okay, so it's easier to inject the local back away from the nail. Where the tissue is soft, it absorbs it with a minimal amount of discomfort, and then the entire toe goes
But my point was, putting that big old needle in it didn't really hurt.
Well, that's a good thing.
It didn't hurt.
It could.
You say it could have?
It could have.
Oh, Lord, because a sweet neighbor had the same thing, and I convinced her to go to this podiatrist and do the same thing. And she came back and raved about the guy.
Oh, that's good too.
So we were both lucky.
Better than hating you for the rest of her life. Thank you for that recommendation and the pain you caused me, Joe. But that didn't happen, right?
It didn't happen. Folks, knowing that Dr. Koenig has also got several patents on ankles and toes, I asked him a question because I'm familiar with the case. Most of you know what MRSA is. And my wife and I know of a case where a person has MRSA where they've got an open wound almost to the top of their foot up into the leg.
Yeah.
And I ask you a question. Let's say if the wound doesn't close up, would it be possible to replace the ankle?
Of course, every case has to be evaluated before,
Right.
because that's a pretty extensive procedure. But the answer to your question, the short answer is yes, after the infection is cleared up. You can actually replace an ankle joint were it to be diseased or deformed.
Yeah. We talk about replacing knees and hips,
Yes.
but we don't ever really talk about wrist joints, elbow joints, and certainly ankle joints.
Well, they're certainly newer in the world. I read an article the other day. They traced the history of knees. It's done since the 70s. Knee replacements are done since the 70s. Ankles came to light in the 1990s, but they were experimental and only a few doctors were allowed to do them. And it's only in the last 3 or 4 years that the courses have been taught and the FDA has approved the use of ankles in the United States, ankle joint replacements, that is. So it's a relatively new subject. The research is old now, of course, but the work itself is relatively new. So it is a subject that we yet need to discuss.
Yeah, and I think it's important. When we do these special television shows, and especially in the field of podiatry, we're talking about senior care of seniors' feet. As the joints get older and we have more problems, we have things called hammer toes, and we have other joint problems. You have several patents, and one of them is for a toe replacement. Am I remembering correctly?
You are remembering exactly right. Yes. So
what do you do to replace? Is it something that would help a senior maintain their balance with replacing a toe joint?
The majority of our patients are seniors for total joint replacements of the great toe joint, yes. The majority. The mean age for that procedure is about 55 years old, but that means that better than 50% of those patients are seniors.
Wow.
To make that number that high, yeah.
Is it a difficult operation for a senior?
I don't think so. I think when you're in the hands of somebody very skilled, the surgery goes very nicely and the recovery is relatively short. The discomfort is easily controlled today. I think the answer is no, it's not a terribly difficult procedure for a senior to have.
When I read some of the paperwork you sent me, you talked, one of the big things you emphasized was proper foot hygiene and care of the feet. Perhaps you could give our viewers a real good overview of what constitutes good preventive care for foot maintenance.
Okay, so this would apply to everybody now.
Okay.
And then with the special emphasis on seniors, and then more special emphasis on those with diabetes and other complicating illnesses. But in general, we're talking about everyone. So this is what we usually see happening. The foot gets its hygiene because the water runs down their body with a little soap in it, and the feet get rinsed off and dried, and that's the end of it. But what I'm suggesting is a more careful indulgence in the hygiene of the feet. So I want them to be washed daily, and I want them to be washed with either a brush, a bath brush, or a washcloth with soap. I want the foot to be scrubbed top and bottom and between the toes, where it sometimes gets sweaty and sock and accumulation get, mixed with the sweat, and then you've got this little object in there that causes athletes' feet, which is a problem in itself. Itchy, to be sure, but complicating because it cracks the toes and could lead to a secondary infection, and that takes us back to what we've been talking about earlier, infections of the foot, how devastating they can be. Well, anyhow, moving forward, so I want the nails to be trimmed properly and cleansed. I'd like the dead skin in the corners of the nails and the grooves.
What is the proper way to trim a toenail?
So the proper way to trim your toenail is about a 1/16 of an inch longer than where the pink leaves it, and then so you've got this little white trim. Yes?
Should it be cut straight across?
Well, that's a very good question, and so many people ask that. And the short answer is no. What you should do is follow the contour of the toe. If you're one of those persons that has a square blunted end toe, and there are those, then you do want to cut the nail square. But that's usually not the case. Usually they're slightly rounded, and I would expect the nail be slightly curved too.
Well,
not so deep as that you cut into the ingrown nails.
As you get older, the back doesn't bend so easily, and the knees don't bend so easily, so you can get the toe up where you can see it so easily, whether you have glasses.
Right.
So one of the dumb things a lot of us seniors do is cut our own toenails.
Right.
And you run the risk of not only cutting the toenail, but the toe.
So, Joe and I we were naval officers at different times, yes?
Yes.
And maybe, well, anyhow, the thing is that, remember we had the buddy system? It's a very important system in all militaries, that you share something with your close friend or comrade, as it were, at arms. And so I'm suggesting the same thing for foot care. You need a buddy. It can be your spouse. It can be a good friend. It can be a caregiver. It can be a nephew, niece, but somebody needs to do that for you, because we've been blessed with a foot that's longer than our arms. Our legs, rather, are longer than our arms. And not only that, but they've put our feet right at that focal point where your nearsighted glasses don't really help you anymore, and your farsighted glasses don't help you either. So it's a slight blur there. So it'd be better if you didn't do it yourself.
I try to carefully cut mine and hold my hand over so the nail doesn't pop all over the bathroom floor. and then I have, my wife bought these nail files. They're about this long, but they're sort of rough on one side and less rough on the other. Uh-huh. And I get that rough nail file, I can file the ends of my toenails down to where if I did that more regularly, I could walk a lot easier.
Yeah.
One thing we don't, I dare say many seniors don't think about the fact that if your toenails are not correctly trimmed, that the edges of those toes hurt, and it makes it more difficult to walk.
Right, because they're little knife blades that you left behind.
Yeah.
The edges of the nail are they can be very, very sharp. But moving forward, So after the bath and after they're cleansed, we want them dried. You have to get a towel and dry between your toes and the entire foot. Lotion them up with hand cream, which is a good idea, but certainly powder them or powder your shoes to keep them dry. And that in itself would be preventative for maybe 50% of the problems that I see daily.
That would prevent most of them.
It would.
I know you must get asked a lot of questions about, you mentioned the word athlete's foot. For seniors, as you get older, what would be some of the better sprays that you buy over the counter for treatment of athlete's foot?
Sure.
I use something called Tinactin.
Yeah.
That's good?
Yes, it is. Tinactin has been around for a very long time, and it comes in a liquid, cream, and powder, and it's very, very effective. It's a nice preventative medicine in particular. We now have stronger antifungal creams for outbreaks of athlete's foot that are infected, but as a preventative measure, Tinactin's one of the better ones, yes.
How does a person know it's time to go see a podiatrist? When you think about the athlete's foot or some of the other infections you get on your feet, how do you self-recognize when it's time to see a podiatrist?
So I suppose most people wait until they develop some type of symptom. And maybe that's not the right thing to do. Maybe they should have it on a schedule where they just plain old go and let the decision be made by the doctor saying, you know what? I've looked at your feet, Joe. I've checked them out. We trimmed your nails. We did this, we did that, the next thing. But the point is that they're perfectly healthy. I'll see you next year.
And the old brain sort of relaxes a little bit.
It does, because I don't have, unless there's something acute that happens between now and then, your mind's at rest about your feet for a year.
One thing you never see is a foot doctor advertise the cost of what an examination thing costs. What would be a fair price if somebody said they wanted to go to a podiatrist to get their nails, get their feet checked out and get their nails trimmed? What would something like that run?
Most foot conditions are covered conditions by either insurance or Medicare.
Say that, because that's what I was leading to.
Yeah, it's not really a necessary consideration, because most of the problems or prevention of problems is covered conditions.
Most of us, as we get older, we are reluctant to spend money on our own body and caring for ourselves. And it goes back to that old business of ounce of prevention and a cure and all that stuff.
Yeah.
But when they passed Disabilities Act,
yes,
most of these things are covered under Medicare and Medicaid.
They are.
So that all these things, if you go into your primary care doctor, we go in there and generally we say we got a breaking out here, or we got something hurts, or our neck hurts, I can't stand up straight. But we never take our shoes off and show our primary care doctor the condition of our feet, or talk about the condition of our feet. When in fact, if we did a better job of alerting our primary care doctor to some of the things we think we have wrong with our body, they could get us to the right people to take care of that problem.
Yeah. There's so much to be said for the fact that people can come in and just and have an exam by a professional and get a clean bill of health. But something just came to mind as you were saying that. There is a rare condition called subungual melanoma. So now, what does that mean? It means below the nail, there's a cancerous skin tumor. You would never know it. They don't hurt. They're below the nail. There's nothing to be seen other than a discolored nail, which could easily be excused for an injury to the nail, a bruise, a black and blue mark on the nail, or two, a fungus nail condition. But this is yet something else. You wouldn't know it's there unless you had an experienced eye looking at it and say, well, you know something? There's something about that nail that's not right. Let me numb your toe, remove the nail, let's get a biopsy of that and find out what it is. Now, that little action by showing up that day is life-saving, because if you left that to be neglected, the next result would that you would be losing your toe if you acted quickly. If you didn't act so quickly, you could lose your foot. Okay. And if you acted even more slowly, it would take your life.
We talked about vibrating shoes.
We do.
You got about 2.5 minutes to tell our viewing audience about vibrating shoes.
Great. So I invented something called the vibrating shoe, and the company is Good Vibrations. We were just received our funding so that we can go forward with shoes. But anyhow, what they are essentially is a very, very high quality leather walking shoe for men and women. It comes in their sizes. And by the way, it comes in widths too. And located in the heel of the shoe is a self-contained solid-state vibrating system that has 4 cycles on it. So it changes its pattern randomly. You start and stop the motors with a remote control for your pocket, or you can wear it on a bracelet as a wristwatch. And just press the button and the shoes will begin to vibrate. They run for about 24 hours and then they need to be recharged. And you can recharge them by plugging them in the wall or plugging them into your computer.
What do you hope to accomplish with a vibrating shoe?
So that's the important thing. First of all, they feel very, very good, because who wouldn't love to be sitting here right now getting a little...
I can imagine what it would feel like.
Yeah. But it's stimulative to the circulation in the foot. So you take somebody like a diabetic, for instance, who has a cold, kind of achy foot, and with these shoes, all of a sudden, the blood flows through the foot a little better. It's warmer, and it's soothing, and it soothes the achy muscles and pushes that oxygen into the foot and the lactic acid out. So it stops that achy foot that people experience. Now, that being said, they also stimulate the nervous system on the bottom of the foot. So somebody who has lost their balance because they're a little older, and that little nervous system has, if for lack of a better term, has gone to sleep, this wakes it back up. So you can improve the balance in older adult, helping prevent falls, which is the number one.
Fall prevention is it's something that all therapists go for. Anything you can do to help people prevent falls.
Anything you can do to prevent a fall, because it's so devastating to an older adult.
But the other thing is, and we're almost out of time, but that ability to cause the blood to flow in your lower extremities is even more important.
Very important, and that's our real big feature. So that's what they get just from a shoe that can do something else other than just be worn. Okay. And we call it a shoe with a purpose.
Shoe with a purpose.
Yeah.
Thank you, Dr. Koenig.
My pleasure. Thanks, Joe.
Enjoyed having you. And thank you, viewer, for watching today's episode of Focus on Seniors. If you have questions or comments, please call us at 321-473-7770. And for more information on senior care and resources, visit our website at helpingseniors.brevard.com. Be sure to listen to our Focus on Senior radio show every Thursday morning on radio station WMEL at 9 a.m. And when you leave the radio station, you can go pick up an edition of the Florida Day newspaper, look in the health section, and you can read our Thursday morning Focus on Senior column. I'm Joe Steckler, and I thank you for joining us today for Focus on Seniors.